On behalf of the Forum for Healthcare Strategists, I want to thank you all for joining us today for the Diversity and Inclusion in Healthcare Stanford Healthcare's Journey conversation. We all know how important it is to have that these issues are in our society today, and we know that these conversations need to happen, even though they're very difficult at times to have had. These conversations are critical for us in order to affect change. Today, we're honored to have three leaders from Stanford Healthcare with us to share their journey toward creating a culture in which diversity is celebrated and all people are included, respected, and valued. I'm honored to be the moderator today. I'm Chris Boyer. I am a marketer, healthcare marketer, and also a podcaster. And I'm pleased to be the host for this such an important discussion. You know, many of you may know that I live here in Minneapolis. And this summer, in fact, on May 25th of this year, in a very already difficult year that we faced, something happened in my city that sparked a nationwide, no, I should say a global conversation about such an important topic. And what we have felt here in Minneapolis and what we still continue to feel to this day are the ripples and effects of such a profound impact that diversity and inclusion has to all of us in our society. The conversations that we're having today are very difficult at times. They shake our fundamental beliefs at times, and they've caused all of us to go to very uncomfortable places. And I think and reflect on the healthcare industry itself. And I think that our industry are poised to be the leaders, the examples that we need to face as we look at diversity and inclusion in our workspace. So today I am pleased to be having a conversation. Today our panelists from Stanford Health Care are David Entwistle, who's the president and CEO. Thank you for being here. Barbara Hardy, who's our Chief Diversity, Inclusion, and Health Equity Officer at Stanford, and Michiko Tanabe, who is the Chief Marketing Officer. Now, a couple of notes before we begin. We plan to have a very interactive conversation today. If you have questions for the speakers, please take a moment to find the Q&A button at the bottom of the screen and, and be sure to ask your questions there. We will do our best in that Q&A answer pane to respond to any questions that we have throughout the dialogue. We also will be conducting some interactive polls today throughout the webinar. We want to ensure that you participate by clicking on the answer that best reflects your views. Now with that, I am pleased to begin the conversation. And what I'll do first is, David, I will put you in the hot seat first. Thank you for being here today. I appreciate your time.
Absolutely.
So let's start off with this. Many organizations have looked at diversity, equity, and inclusion initiatives, but the conversation we're about to have, the journey that you were on, feels a little different than others. So maybe you could start. Tell us what led you down this path.
You bet. Well, Chris, let me say first off, thank you for being willing to host us today. And it is very sobering that you are in the very city that started this journey for us in a much more meaningful way. And I'll share a little bit about what that means. I also want to thank the individuals that are online today. I see we have well over 100 folks that are taking your time to make this a priority in your own organization. And what I hope that you walk away today with is a better understanding of some of the things that we worked on, what we have done. But let me just say, we don't have a perfect strategy. This is going to share with you the journey that we're on. Hopefully, you'll be able to have a few takeaways on some of the things that we've been able to do. But please don't see this as the perfect strategy. Hopefully, you see some things that you can take away. And I'm grateful to be here with Michiko and Barb today too, because it has been a great journey together. Chris, I loved one of the things you said, because you think about as we started this journey, this is a difficult conversation, and um, it's a hard conversation to start because you don't know, am I going to say the right things? More importantly, am I going to say the wrong things? Are there things that I'm going to offend other people? And so I will tell you, I've been on a bit of a personal journey myself as I've thought through how do I approach what I need to help lead in the organization. And it was very important for me as the president and CEO to be out in front on this. And so some of the things that we've been looking at specifically, and I started with just having an opportunity to talk with some of the Black executive leaders in our organization. That was a very meaningful conversation to me. One of the first ones that I had the conversation with, he went through the process of telling me about the talk that he had to have with his son. And I'll have to admit, I didn't know what that meant. I do now. I know how important that was. I also know that one of the other executives made the comment at one of our employee forums that says, don't be afraid to begin the conversation. Make sure that you're saying those things and you can, couch it in the right way so you don't offend. But in some cases, it'll be more offensive if you don't start the conversation. And so, as I looked at what I was on a personal journey, and certainly as we saw the events, and I will say that with the murder of George Floyd, that created a much different perspective in my own mind. There's certainly a lot of events that have gone ahead of that, but I will tell you, it was meaningful to me because it was one of the first times that I participated, along with my dean of the School of Medicine and the CEO of the Children's Hospital here at Stanford, that we had the opportunity, the three of us, to go to a rally that was put on by our medical residents and students. And we knelt for 8 minutes and 46 seconds. That had a tremendous impact on me as an individual. And I knew at that point we had to do something different. This had to be a different conversation in our organization. And it wasn't just a one-time event. And that's one of the things I hope that we all take away today is that this is an ongoing, and I love the journey word because a journey is an important aspect of this and how we approach it. But it was certainly very purposeful on our part and in the way we approached it.
And I know that many organizations have, prior to what happened, the tragic happenings of this summer, have had diversity, equity, and inclusion initiatives. I'm curious as to, as you reassessed, as we all did, we reassessed our role in society, our role and responsibilities as organizations serving our communities. When you took inventory of what was there, what were the things that you were able to leverage as you started to begin down this path of your journey?
And I'll say there is what is neat is when you start to dig into some of the materials, and we'll share a little bit about some of what we did internally, but we had a tremendous amount of resources internally already. We had a tremendous number of committees that we had set up. We
Mhm.
had just previously on the last year stood up 8 employee resource groups around different diversities and things that we were looking at internally. And I had the opportunity to be at those kickoffs. And so I was not a stranger to that, but it was something that we felt was important. But I would say the thing that we leverage the most is a willingness to engage, because that's what it really takes in your organization is a willingness to get behind this, a willingness of not only the executive leadership, but for your vice presidents, for your directors and managers to say, yes, we will take this on as a priority. Now, if you think about it, obviously this is in the midst of everything we've dealt with this summer with certainly in the spring and COVID and all the pandemic and all the pieces that were going around us. You think about all the priorities that we had on our plate, but we had to make sure that we were setting aside those times to do that. One of the things that we did leverage internally is the dean and the CEO at the Children's and myself, we actually put out a pledge statement. We wanted to be very definitive, very direct, and make sure that we let not only our community internally, but also external to our organization know how we felt. And the three core elements of that were, first of all, we would not be silent on this issue. This isn't something that we were just going to let continue to play out in the community without us being part of that. The second piece is a literal statement that we would use our influence as a community leader, as an individual in the uh, academic circles, use our brand to basically leverage that we could influence and make a difference in this. And then the last piece was just simply to say, enough is enough, and that we wanted to call this out as something. And so you have to look at those pieces that are internal to you to see what you can do to leverage and make sure you're pulling out all of the appropriate cards, but sometimes even going beyond the comfort zone of what you'd be willing to normally do to make sure that you were very visible or we were very visible on this.
Well, an important part of this conversation is to lean in on those areas that make you uncomfortable. And some of the areas when I assessed personally, or we assess it as a community, are challenges that we faced. I would assume that Stanford itself also presented some unique challenges. Is that correct?
Yes. Well, I think certainly we all have to look internally and see where are we at in that personal journey.
Mhm.
That's why part of the internal is how do we create for us a cadence that we all know that people come in with a different perspective on their learnings, but what is it going to take to do that in within our own selves? And I'll have to say, one of the challenges is when you have an introspective look and you actually say, maybe I do have some internal biases. Maybe my organization isn't as forward thinking or as innovative in some of the things that we need to be looking at and doing. Maybe we have not engaged the right folks internally. And I'll have to say, that's a challenging conversation. Now, the fortunate part about that, we had started that conversation years before this actually came about. And so we had some, and I will tell you, if you have those or have had those conversations in your organization, it's amazing. You get a lot of accomplished executives around the table and tell them that they have flaws and need to improve. They react to that, not necessarily in ways to say, oh, yes, I need to improve. So we had to have those hard conversations internally and had those. But I would say if you aren't on that journey, first of all, get started, but understand that you're not going to be perfect in everything. You've got to be willing to accept that about yourself and also be willing to start, because I think that sometimes is the hardest part.
Mhm. Yeah, it certainly is. And it's not lost on me that we are in a health system. We all operate in health systems, and the role that health systems have in our in our communities is very strong, and at times can be very impactful, both in positive and negative ways. We've already been going through a lot, as well as you mentioned, with the pandemic. I'm curious as to your perspective on how you felt that this is the role of Stanford in your community, and maybe even taking that broader to share a little bit about how you feel that around health systems across the country as well.
Well, I hope we all start with the fact that we are the communities that we serve. We are the advocates in the communities that we serve. And one of the challenges I think that, our employees are those communities. Those individuals come to us in those times of need that they need help. And they expect to be able to do that in a sense of fairness and without bias.
Mhm.
We all know that there are health disparities as a result of diversity in our individual health systems.
Mhm.
If we don't feel that way, we need to really have a hard internal look. I know we have those at Stanford. And when I was on and continue to be on my journey of learning, I had the opportunity to speak with one of our gentlemen that is on our board of directors, who is a Black American, who is an incredible individual, incredibly accomplished CEO, but talked about that he is a patient in our own organization experienced bias. You can
Mhm.
imagine how hard that is to hear, but yet how important it is to know that in this case, we could have done better with that community that we serve. And that's, I think, one of the difficult parts is to say, where do we get started? But I think we have to know and have to say, this is part of what we do and need to be able to provide that. And certainly for Stanford, like probably many of the organizations on the phone, Stanford's a strong brand. There's a sense of professionalism in this market. And we've got to make sure that we're living up to that when it comes to the way that we serve our community.
Absolutely. Now we want to pivot a little bit to understanding how you kind of prepped your leadership and the leadership team at your organization. And this is, and maybe we could start, David, but I would definitely like to also begin to include the others on the panel, including Barbara, around this. Tell us a little bit about how the leadership team responded.
Yeah, I will say kind of what I was alluding to earlier. So I started off in one of our executive council, which includes all of our C-suite executives, and we began this conversation actually with some data about the organization that we had actually gone through and done probably over 100 individual surveys, and the data didn't look good. I mean, I have to say, as I looked at it and thought, oh, that doesn't quite sound the way that I would have anticipated our great organization to be, and that caused some great conversation internally. Now, I'll also say that our immediate reaction, because a lot of times we're interested in making sure that we get things done. And I have to give a shout out to Barb, who's on here today with us, who was part of that conversation, because of course, as the CEO, I immediately jumped in and said, okay, well, let's do this, let's do this, let's do this. I had all the tactics, all the things that would solve it. And she goes, wait a minute. She goes, we need to make sure we're asking the organization, what are the things they see as the solutions? And that was a bit of an aha moment for me. And I appreciate Barb doing that for me. But it also allowed us to then take what was the data that we had collected on where we were at the organization, that we had just had those hard conversations with our executives about, then go back to the organization and say, what would be the most important that we could work on today that would make a difference for you? And I'll have to say, what we came back with was different than what I was starting to rattle off. So I was so glad that we spent the time to do that and ask that question.
Mhm. Absolutely. Well, this would be a good time for Barb. Welcome to the conversation today. I know I'm excited to talk with you as well. Thank you for your time today.
You're welcome. It's a delight to be with you and with everyone.
So, Barb, your role is a significant role at the organization, Chief Diversity, Inclusion, and Health Equity Officer. That's very significant. And as David discussed how Stanford aligned and started to launch this initiative, I'd love to hear your perspective on that, and also how you yourself define diversity, equity, and inclusion.
Absolutely. So, what I will share is a couple of things. One, I'm 4 months into Stanford Health Care. So, I have a tech background. I've joined. So, some of this work was already occurring.
Mm.
And so, David talked about, the mission and the vision and our employee resource groups, right? And I'll be talking about inclusive leadership. But before I get there, because there's some foundational pieces that are important, I think it's also important, as David has said, we're new in the journey. So many of you may be farther ahead, but certainly what has transpired has required all of us to go back and relook at our strategies and our initiatives.
Mhm.
So when I think about diversity and inclusion, diversity is about the differences. It's the different dimensions of diversity. It's not one or two or three. It's the ones that you see. Everyone can see me right now. I can't change the color of my skin. So you can tell that I'm African American, right? But there's also other pieces of me that you can't see. I tend to use the iceberg analysis that says, okay, there's the tip of the iceberg, right? So race and sex and age, perhaps, and gender identity, ethnicity and sexual orientation, perhaps, and some of the physical ability. But then what's happening at the secondary, level, right? Religion, that's where education sits, and relationship status and working style. And many of us through COVID-19 are at home. So we're really dealing with this dimension of diversity, right? And this flexibility of, well, what is it like to be working from home?
Mhm.
Then there's the organization, right? So where you sit in the organization, you can be in the organization and have a different experience, right? Different experience than the CEO or a leader, etc. And then there's the cultural piece, which we're going to get into a little bit as well. And so, these dimensions of diversity are, what do you see? It's secondary, organizational, and cultural. I mean, think about introverts and extroverts. I am an extrovert. So I'll tell you right up front, for you introverts, you may be going, okay, calm it down, bring it down a little bit, but that's who I am. So that's diversity. And then when we begin to look at inclusion, it's really about, how we're embracing these differences and the similarities, right? And that's ensuring that all people are included. I have a saying that says, you know what, if you're not intentionally including, you're probably accidentally excluding, right? So we have to be intentional in that work. And just because we include does not mean that, or we say that we're inclusive, does not mean that we include everyone. We actually pick and choose, right? So I got selected to be on this panel, right? So others did not. And then I also bring in belonging. And belonging is very important, because I really do believe that until people belong, then inclusion is not going to happen.
Mhm.
And so what is belonging? Belonging occurs when everyone feels valued and respected and seen, right? And the research shows that that same area in the brain, where when you stub your toe and you know how your whole body goes down, right, to protect your toe, okay? That pain just reverberates in your body. well, this is what happens when people are excluded. It's the same area of the brain. So it's that physical pain of being excluded. And to fully belong, everyone needs to be free to be their authentic self, right? And so then as we begin to look at equity, we're talking about just and fair inclusion where everyone can participate, where they have opportunities to participate, and where they can reach their full potential. So as we begin to look at outcomes, and equal opportunity should also equate to equal outcomes. And so that is some of the just foundational work of how we define diversity, inclusion, belonging, and equity here at Stanford Health Care.
Well, I think I love the way you position that, Barbara. I think that makes a lot it's a very complex conversation, it's a very complex topic. It's hard to encapsulate that into 3 words for sure. What I think, I know we're going to be sharing some of the journey and some of the framework that you have, but before we do, this might be a good time for us to actually initiate one of the first poll questions to ask our audience. And this is the
Yes.
interactive part, right, of the conversation. So I'll read off the poll here. To what extent do you feel your organization is fulfilling its aspiration of equity and inclusion for all dimensions of diversity? And you can see here we have not at all, to some degree, moderately, very, or extremely. Please take a moment to vote. And I think that this is an important start of the of our poll today, Barb. Is that correct?
It is. It is, because this is an opportunity for everyone to just share where you are at.
Mm-hmm.
And just to let you know, this is a trusting conversation that we are creating here. And we recognize, just as David said, and you'll hear me say, we're not perfect. There is no perfect organization. All of us have a journey,
Mm-hmm.
right? And we're all on a journey, and we're at different places.
And we
And
can see
so,
yeah, we can see
go
the
ahead.
results here too, right? And so does this surprise you, Barb, when you look at the results?
No, it doesn't, because this work is constantly evolving. And
Mm-hmm.
so, there are a couple have said, hey, we haven't even considered this at all. And some are saying, yeah, to some degree, yeah, we're about there moderately and very. And then we have some that are like, hey, we're leading this pack. We're extremely. So I am not surprised at where people are.
Mm-hmm. Mm-hmm. Yeah, absolutely. Well, why don't we take a few moments and you can walk us through sort of the journey and the framework in the next couple of slides, because I think these are going to be very telling for us.
Great. So I think it's very important to just start with the journey. And this is really what I think about the work. And what I can share with you, having done this work and coming out of tech, and then also working in tech as a coder
Mm-hmm.
and as a configurer of technical systems and running global technology projects. What I want to bring to our conversation is, listen, all of us have policies. And, our policies can be around diverse representation, because we need the leadership commitment, we need the leadership capability and accountability to support our diversity program. So whether it's diversity, inclusion, and equity, so you need that leadership commitment, and it starts at the top. David sets the tone, right? And even as leaders, people leaders, we set the tone. Why? Because people are going to follow, your teams are going to follow you. And then there's the pay equity and the diverse pipelines and all of the various programs. And then, we talked a little bit about the employee resource groups. And then organizations are hiring chief diversity officers. And sometimes what happens is it stops right there. Okay, we got the program, we got the officer, so we've got the policy. So now everybody should just do what they're supposed to do. And the thing is, you cannot legislate hearts and minds. Our culture, our mission, our vision, our values also play a part, because this is really about the strategic business imperative. This is about being part of our business, our own DNA, and not just a program that's owned by the chief diversity officer or inclusion, diversity, and health equity. This is about all of us, everyone playing a role, and that joint ownership, which really leads me to the personal activity. It is important that we all recognize that it takes an integrated behavior approach. that leading now requires us to change and to flex in ways that perhaps we hadn't even considered. And belonging and inclusion is really that key, because it's about increasingly mitigating our bias and checking them. It's also about being curious, and you're going to hear me talk about some of these various inclusive leadership behavior traits. It's also about modeling this. This is practice. So I call leadership a muscle. It's a muscle. It's not a title, because you're a leader that has to continuously evolve and engage. So there are new traits and new behaviors that all of us as leaders, and I don't mean that just as a people leader, because many of us are leading projects, we're leading teams, we're leading by influence. And so as part of being a leader, that's action and being active. And here's the net of it. Because at the end of the day, this work, when it is done well, should do two things. And it's a reason why all of us are at our various organizations. One, it should be improving our organizational performance, organizational excellence, right? And individually, we should be growing and improving our own excellence, right? Our own personal development. So what I've really seen, that it is not just a one size fits all. It's not, hey, we've got a chief diversity officer and we've got these groups and we've got these programs, but it's also about our mission and our vision and our culture. And it's also about our behaviors and modeling that. And that sets up our DNA.
Yeah. So you mentioned inclusive leadership and the importance of that. And I know there is a framework that we're going to discuss around this. Oh, okay. Well, here it is. So well, feel free. Go ahead, Barbara. So.
All right. So I've laid the foundation of the journey, right? Because this is a journey. Right. And the next piece around this is really looking at, so what is our strategy as Stanford Health Care? We talk about our people. Our people are our strategic advantage. It doesn't matter where you work. There's no one else like you, right? So there's no one else like our people. And that's what sets us apart, how they treat our patients. And then there is our leadership. So, as I was talking about the role of leader, and you're going to hear me spend more time about that, whether you're a people leader or not, what you're really seeing on this slide is some of our initiatives and some of the programs and some of the policies that we have in place and how we've embedded ourselves, this work into that. So leadership and how you lead matters. Then there's the workplace. So when I show up at the workplace, how do I feel? What are my facilities? What are the services, right? So how does that workplace make me feel? Do I see myself included? Right. And this is really, as marketers, where we begin to look at, okay, so what's happening with our videos and our blogs? What's happening with our town halls? As we're looking at town halls and various town halls I've run, this is a Disability Employment Awareness Month. And one of the areas that we've been seeing is that we're using sign language interpreters, right? Or we're using closed caption so that everyone can be engaged. Well, that's just a norm. This isn't about, well, it's Disability Awareness Month. It's really about how we as an organization do business. And then there's the patient experience in the community, right? So thinking about external branding and recognitions, do our patients see themselves? And at the end of the day, here are the business drivers. Market revenue growth. So you heard me talk about the organization performance. How are we moving into new markets? Our patient satisfaction. Are our patients, all of our patients, going to recommend Stanford Health Care or just some of our patients? I'm not satisfied with just some of our patients. I want all of our patients to be out singing and sharing that Stanford Health Care is the only place to come. And I know I probably pissed a couple of you off, but I just want to let you know where I'm at joining in. But then there's the recruitment and advancement and retention of talent. Imagine what people are saying about your organization or our organization. And then think about what our employees are saying, right? So many times we're looking at externally, but what about our employees? Would they recommend us? Are they waiting until COVID-19 and everything else settles and say, hey, I'm out of here? Mm-hmm. We talked about performance optimization, but then there's the protection of the corporate brand value. And that is very important, especially as we have seen what has been happening while we're in COVID, while we've seen the murder of George Floyd, of Breonna Taylor, right? And because we're in COVID, that these are not new things. This didn't just happen. This has been going on. But because now we've been in a place to be still, that there has just been a trifecta effect of, hey, while corporations and hospitals and businesses are saying, yeah, we're standing with you, then now people are saying, show me. So it's not enough to just talk the talk. Now it's the walking the walk. So that brand value matters, as well as innovative solutions. Listen, we know that when we come from different experiences, different perspectives, we've lived in different places, that when we get together and we can share our best selves and provide our insight and our perspective, that what we develop is so much better than if we did it alone, or if we did it within people that just look like us and think like us. And so these key business drivers are extremely important.
Barbara, before we move on to the next slide, there was a question that came in from the audience, and I thought this might be a good place to insert that question and pose it out to you, because we are in a polarized society here in America. And so as you talk about this, it sounds to me like this is a very inclusive approach, yet how do we model that against the polarization that's in our society?
Well, this is really about, what I believe is really a time for us to demonstrate who we are.
Mm-hmm.
At our core, who are we? Who are you? Are you one that gathers? Are you one that separates? Are you one that inspires? Are you one that's open to learning? And so absolutely, is the polarization happening? Yes, but there's also more people that are gathering and bringing other people together and asking, what can I do? I mean, I was on a call today, and one of our leaders was sharing with me about his daughter. She's not at voting age, but she's taking action, and she's written postcards to people who are at voting age and saying that our future matters, and encouraging them to vote. Could you imagine that? I mean, she's not at voting age, and yet she's saying, hey, I just want to let you know this is important to me. So when we think about this work, the polarization, we're going to have to address it.
Mm-hmm.
We, in our organizations, we should have policies that say that will not be tolerated. And it's not enough to just have the policy, we've got to act on it, because when we're not acting on it, then it impacts even a larger percentage of our organization, because at the end of the day, it won't be what you said, it will be what you do.
Mm-hmm. Yeah, that's great. Thank you, Barb, for that. Let's talk a little bit about inclusive leadership and some of the characteristics around what that looks like.
Absolutely. So excited to share this. And I want to, share that these 6 inclusive leadership traits have come from Deloitte, and this is from work that they did. So they actually engaged with over 200 or 300 global leaders. And really what the premise was to really identify what are the behaviors, what are the traits that set leaders apart. And again, we're talking not just about people leaders, but also about those of us that may be leading projects or influencers, right? So this includes all of us.
Mm-hmm.
And they wanted to know, well, what is it? What differentiates the leaders? Who are the best and the best? And how do they show up? What is it that they actually do? And this research that they didn't just stay in tech, they went across the board from various organizations. And that was another piece around why I found this to be just, quite honestly, life-changing. Because the role of the leader matters. You cast a shadow. If you're leading a team, if you are leading a project, we cast shadows. And just think about the best leader that you worked for. What did they do? How did they act? How did they show up? And I bet you can remember it now. I have some great leaders that I've worked for that even if they ping me now and while I'm on this, I'd be following up with them right after this call. right? Because they totally, influenced and changed my life. So inclusive leadership is the new paradigm. And what you're really looking at are these 6 traits. So cognizance is around bias because it's our Achilles heel. We don't know what we don't know. And with bias or cognizance, this is really about self-awareness. It's about understanding your blind spots and triggers and biases. And if you're curious about your biases, you can take the Harvard implicit bias test to find out more about it. It's also about organizational biases. This is the way that we've always done it here. So we're going to continue to do it here. It's about checking these to determine how we need to eliminate or mitigate them. Mm-hmm. But it's also about our relationships. And, Chris, you were talking about the polarization and really asking ourselves, how are we developing meaningful relationship with people who think differently than us, that maybe look differently than us? I don't know about you, but I do something called virtual coffee. I've done this globally within organizations, and I do it here at Stanford. That, I provided opportunity to just have 20 minutes with me as a meet and greet to get to know each other as individuals, as people. Yeah. Before we get to work. And so, it's that investment in the development of meaningful relationships across difference that really sets the leader apart.
Well, this might be a good time for us to maybe launch the second poll question, which is around cognizance. And so we're going to ask our audience, how self-aware do you feel you are about your blind spots? And again, we see the range of questions here. One of the things, Barb, as I think about self-awareness, and Michiko too, I think about this, is that my implicit bias sometimes is hard for me to be honest with myself about where my blind spots are. How does one address that? How does one really have an honest dialogue with themselves around this?
So I'll just kick it off and say, what, I would do a couple of things. I would talk to people who I trust. And I would talk to people who's going to tell me the truth, right? So not someone that's going to be blowing smoke, but someone that's going to tell me the truth. And I would also look at people that are above me and below me. Mm-hmm. Yeah. And I would ask them, what do they see? What can I improve on? How can I be better? Mm-hmm. Because many times with our biases, what's happened is that we're making decisions or judgments without question. It's an automatic response. It's a shortcut of how we influence, or interact with the world. And the reason this happens is because scientists say that we have about 11 million pieces of information per second that's coming at us. And our brains have to figure out, how do you dissect that? How do you stay on track? And so, what I find is, one, definitely talk to people who trust you, who you trust, and who will tell you the truth. The other is, when you think about when you're making decisions, being aware of how you feel. Mm-hmm. And the other is to pause, because a lot of times what happens is that, we're still running at breakneck speed. And now we have, the inside and the outside together. Mm-hmm. Those of us that are working from home, I expect to see dogs and children and all of that, right? It's just the way it is. It doesn't matter how much you try to tell people, I'm going to step away and I'll be in this call. But here is what's happening. So we're trying to manage all of that. And many times we're having to make quick decisions. And what I believe is that, let's pause and let's breathe where you can. Let's ask someone that you trust.
Oh, sorry. Barbara, I love what you said, though. Find people outside of your circle at work, especially, because find people to just be honest with you. That's something that I think is so hard to do. Just have very candid conversations, and make sure that you're drawing on those, because a lot of times it's easy to listen to those folks that are around us a lot, and they'll tell us sometimes what we want to hear, unfortunately.
Mm-hmm. Now we have a lot to cover, and I'm looking at the time. We have 20 minutes left. Yeah, so let's advance on and talk a little bit about the next aspect around cultural intelligence. I do believe is our next C.
Can we go back to curiosity? Sure. I want to just talk about curiosity, because being open to different ideas and viewpoints and asking questions is really important. And also actively listening with compassion and empathy to create connection. Because here's what's going to happen. We naturally tend to gravitate to people that look like us, that think like us. And really where the new ideas and the growth comes from is people who actually see the world very differently. And what I share is that it's important to be willing to ask questions, to seek out those diverse points of view, to suspend judgment. Because what's happening many times is that while we're listening to someone, we're in our mind coming up with our response versus really pausing. And David talked about this, having a conversation with his leader who said, listen, I had to have the talk. David's like, what in the world is the talk? Is that a show or what is that, right? But being willing to suspend judgment to better understand the way someone else sees and understands the world, because we're all in the world, right? But we're experiencing the world differently. Right. And so curiosity becomes very important.
Absolutely. Absolutely.
So cultural intelligence, again, even being curious about how someone else sees the world and views the world. Because not everyone sees the world through the same cultural lens. So, it's building that awareness of cultural norms, is being able to flex, recognizing that the way someone else sees the world or experiences the world is the way they see it. It's based on their experience. My experience as a Black African-American woman is different than the panelists that are on the stage, right? So how I enter the world and how I connect with the world is different. And it is a different cultural view. How people can react to me can be different. And so that's very important as well.
Yeah.
So let me just talk a little bit about something that we referenced early on. And Chris, you talked about, where you live and what's happening there. What's really important, especially about cultural intelligence now, because we get a chance to see whether we have it or is there some room for improvement and growth. I want to talk a little bit about, what's happening within our organization about why saying Black Lives Matter. And, again, we cannot legislate hearts, right, with this. You can have policies and things like that, but it's really about how we show up in the stance that we're going to take. And so we recognize that everybody is not for this. Everyone doesn't understand. But what we did was we took an intentional effort to say, we're going to share with you why saying Black Lives Matter. That it's not just about supporting the Black Lives Matter organization or movement, because our work is not tied to movements, because movements continuously change and evolve. It's not politics. It's not partisanship. We're saying this because we value and care about our people, because living while Black is a different experience than what others may experience. And we liken it to, October is Breast Cancer Awareness Month. So imagine during Breast Cancer Awareness Month, someone else came up and said, hey, well, you know what, I have multiple myeloma and I really think that we should be celebrating this. Why are you really talking about breast cancer right now in October? Recognizing that what our peers and our team members are experiencing is different than us. And that there is some trauma from slavery, there is some systemic racism, right? And it's not all outside of our organization. It's also looking at our own processes. But people are in survival mode, and then they're working in our organizations and we're saying, hey, bring your best self and bring your authentic self. But that looks differently during that time, and being able to be aware and being committed to the equitable treatment of all of our patients and our employees is what matters.
Yeah, absolutely. So that brings up the next poll, which is around cultural intelligence, and how comfortable are you with having a conversation about race with a team member, peer, or colleague who is Black or African American? And that's a very interesting question, Barb, as we think about that, because oftentimes there is a lot of uncomfortability in having those types of conversations, correct?
There is, and it's really interesting because So is the conversation difficult? It can be, but we do difficult things all the time. So I don't give anybody a pass for difficult, because we're leaders and we do difficult things all the time. So let's normalize this, right? You know, what we saw really happening was that, we talk about our weekend, right? So if you're into sports, or you're a parent and your children, and so we're having all these different conversations, and yet these things are happening to our people. And guess what? We're not talking about it at all. We're still talking about, before COVID, it was the barbecues and all the times we were getting together. Now we're all on Zoom. And what did you do with your family on Zoom, right? And then we'll say, well, wait a minute, at work, we're not going to have political conversations, when political conversations are going on too. But we're not willing to just stop and just say, hey, I see you. And I'm not asking you to educate me, because that's very important as well. In times past, we've asked people to educate us. What book are you reading, Barb? What are you doing? I had a whole blog around what D&I is reading in another place, because people ask me, what's Barb reading? Now it's very important that we educate ourselves, that we listen and learn, and that we actually just take a step back in empathy and compassion to say, hey, I see you. I'm probably not going to say this right. I'm probably going to make a mistake. But you know what? I care about you. And I just want to check in with you. All that I'm reading, all of the things that continuously happen, because Floyd and Breonna Taylor happened, but it continues to happen. So this hasn't stopped. And that's where the self-awareness happens, because people are still driving to our hospitals, right? So they're in survival mode to get to the hospital. Okay, I got here. They're still in survival mode. If my husband works in medicine, so when he leaves, it's still, is he going to be safe? So this hasn't moved away. It might have moved away for you, but it's happening now. And how are we able to have that conversation? It sounds like people are saying, you know what, to some degree, yes, moderately, very, extremely, well, great. I hope that you are having this conversation, because it does matter. It matters because people want to know that you see them, that you recognize that they're experiencing something different than perhaps you are. So I don't know if Michiko or David want to add anything as well.
I think there's a lot to be said here. I want to let you get through, Barb, because from a marketing perspective and everything that has been said, and it's very rare that a marketer doesn't have that much to say right now. So you all should just take advantage of it right now. Just saying that right now. But part of it is we are in that learning. We are in that journey. We are absorbing. And I think Chris will talk about, how our brand is going to be represented and what we're going to do for inclusivity, and what it means to ensure that our brand is resonating with all. But I want to let Barb get through the framework and then really talk about how it impacts our brand and what we're doing about it, and what David allows us to do, because he's so involved and a part of this journey with us.
Yeah, this framework is very important, Barb, but I also recognize that we have 12 minutes left.
I know, so I better get going. All right. So, so the collaborativeness is thinking about diverse by design teams, thinking about those individuals cross-functionally. They're bringing perspectives and different thinking. It's about ensuring that there are no out groups, because many times in our organization, we've got in groups and out groups, and we're paying attention to people that are in groups, and usually the in groups are people that think like us or look like us. I'm really intentionally ensuring that there are no out groups. I also want to just talk about encouraging and modeling a speak your truth and listening climate, regardless of level or background. And this is something as a leader that I've seen leaders do, that I do. And it really is about what's your truth, because it's important to hear from our people and our peers. What is their truth and their experience? And if you're not modeling it and you're just talking about it, you won't have that speak your truth environment. All right. We're going to continue on around courage. It's about challenging the status quo, including my own beliefs. It's about thinking differently, asking questions, what if? It's admitting shortcomings and mistakes. Here's what I want to tell you. I wasn't always an inclusive leader. And it doesn't mean that you're a robot or a step for, person or anything. This is really about everyday learning. And I had some missteps, some shortcomings as well. And it's really, the more we're vulnerable, and that's why we can say, listen, we didn't get this right. You know, we're still on this journey. We're going to make some mistakes. This isn't the clinical side of the work, right? Where 1 + 1 = 2. This is really about hearts and minds and how we show up. Getting comfortable with the uncomfortable. So this would make you think that maybe I'm comfortable, but I get to talk to David E. and I get to say, David, not so fast. Right? I have to challenge the status quo. I have a bias for action as well. However, in this work, it really does pay to go slow, to go fast. Believe me, the momentum will catch up.
Yeah.
All right. So that's courage. So we've got another poll about courage.
Yes. Let's see if our audience has the courage to honestly answer these questions. So if we can launch the poll here so that we can ask some questions. So the question is, to what extent do we feel our organization is ready to challenge the status quo? We don't all have barbs within our industries, in our organizations. We wish we did, but and how ready are we to challenge that quo and be comfortable with that uncomfortable state? And I think that, you know, in many cases, and David, I might want to pull you in on this, is by setting that's a cultural shift in an organization to be able to challenge the status quo, isn't it? Oh, you're on mute.
It is. It is. And I think you've got to make sure people feel safe doing that. And, you know, they've got to know you as a leader and that you're sharing with them the true perspective. But no, I would agree. You've got to create that safety around them to do that.
And this is where I would actually like to add in, just to say that David is, when he started off, he said he's on a personal journey as well. And it's that authenticity. So Stanford Medicine, Stanford University is an amazing brand. It's got a reputation, but now we are challenging the status quo of the brand, right? So what do our brand guidelines look like? I'm getting a bit tactical because of time, but really, how are we being inclusive? What are we representing? What are we doing? And we are challenging David and others, and my team is challenging me, right? And it's the right thing to do. And I think the other thing that's really important is that vulnerability. As marketeers, and most of you on the line are marketeers, we have a bias for action and for getting it right and getting it right the first time. I'm not saying that we're going to go damage our brand or do anything like that, but it is going to be iterative. And it is truly that journey that we're on together, because we don't know what we don't know. This is new for many of us. I'll be honest, it's new for me. And how I hire the marketing team now and the inputs that they're going to have, that is the constant challenge that I expect and that I'm going to be sharing with the organization. Starts with David, but the entire organization, because the brand permeates all of us.
That's so profound. That's great. There's one more C that we need to cover, Barb, is that right?
The last C is commitment. Why? Because staying the course, the journey, it's building that climate of trust and respect through consistency with words and actions. You know, if we were together, I'd demonstrate what that really looks like. I have to figure out how to do it with Zoom. However, it's walking our talk. It's understanding the uniqueness of all of our team members. Every person on the team, you know, brings their uniqueness. They have come to make an impact. It's ensuring that we as leaders, and even as we're leading teams, that all members are feeling connected to the mission. Why are we all here? You know, so that becomes very important. It's also about taking personal responsibility, which I talked about, and allocating resources towards improving this work, I&D. So we can say, oh yeah, we're committed, but if there's no resources, then it shows that we're not committed, right? If there are not enough people, then it shows that this is what our commitment looks like. So it's not enough to just talk about it. It really is about walking that talk and knowing that the commitment when it gets hard is important.
Yeah. All right, this is, I think, our final poll question, and it's an important one. To what extent do you feel, oh, there's actually one more poll question after this, but what extent do you feel you can lead your team on this journey to make the required long-term and lasting commitment? And I think this is important. And now maybe we can open up the conversation a little bit to everyone that's on the panel to talk about this. Michiko, I'm very interested in, we talk about as marketers, what our impact is on the brand. And you alluded to this. How do you see the brand being impacted by this commitment to go down this journey? How does Stanford's brand be impacted by this?
I think, we have a long, steeped history and legacy with our brand, and it's an incredible brand, but we have to be committed and take the courage and all of the C's to be able to evolve it so it does resonate, and be confident in what we're doing. And I think it starts internally, honestly. And part of that is, how do we make sure that we are inclusive and those voices are heard? And when you have mind share of that brand, what does that brand represent to you? And we can't be all things to all people, but I can pretty confidently say that when you think of Stanford Medicine as a brand today, it's not as inclusive as we want it to be. And so that is the journey that we are taking. But again, it starts internally. I mean, I don't know all of the audience personas. I'll be honest. Like, Barb is my new best friend at work, right? One of those Press-Ganey scores or questions. Used to be the CFO, now it's Barb, right? Because we don't know. And that's part of this and what we're doing and how it resonates with our communities.
It's almost as if the brand is going down the same journey. Is that a fair statement to say?
Yeah, absolutely. And how do we evolve it, and how do we do it in a thoughtful and authentic way? And this is where it'll be very interesting, because you have a lot of voices and a lot of opinions, and Stanford likes to do things by consensus. But what are we going to do, and how are we going to make sure that the brand does evolve the way the organization evolves? And I also want to stress that everybody has said it on the panel. It's not a project. It's not a program. It's not an initiative. It has to be a part of who we are. It has to be part of our constitution, the fabric, as we hire, as we move forward, because that's how that brand builds. And it's not going to happen overnight. We didn't get into this overnight. We certainly aren't going to emerge out of it overnight as well. And so, to your point, Chris, yeah, the brand goes on the same journey. There's pitfalls that we have to be really careful of, but yes, that is exactly where we're going.
Yeah. And if I can just add what David it has done, it is really about not only setting the tone, but demonstrating his commitment. So yes, we have a pledge, but we're also having conversations with the board. We're having conversations in his executive committee meetings, right? We're having conversations in operational leadership, and this isn't a one and done. So this is building and embedding this in the way that we're uniquely Stanford. So I know many of you are saying, okay, so how do you measure it? And I'll respond back to that. I think we're going to run out of time, but I want you to know that that he is walking the talk. And even in areas where I'm not even thinking of, he's like, hey, what about this? And so, we're co-designing this work together. And that's really the key to this, is it's not owned by IDHE or marketing, it's owned by all of us, right? So we all have a role to play. So you may be asking, I know we got to the poll, let me just share with you, why is this important? And it really is about increasing, the experience of fairness and belonging, participation, inspiration, safety. And so you'll have that in the slides as to what is the output? Why does this really matter? What does it do for the organization? So just wanted to share that before we close.
Thank you. There are so many questions, and there are so many people here. And I know that some of that, but David, one question for you that came up is, are there leadership metrics? Are there performance metrics related to this? And I know that's kind of almost antithesis to the description, as Barbara described, about diversity and inclusion being very personal as well. But how do you address that at the leadership level?
So we won't go into the detail, but yes, there are, and that's something that we actually are developing as part of this process, and in fact are tying it into our incentive comp as well. So it'll be something very meaningful for us, and something that will be very in front of our leadership team. But that's happy to share more of that after the fact. So.
Sure, absolutely. Another resonant theme I see from the comments is there's sort of a collusion between diversity, inclusion, equity, and politics. How can we address that? Because, you know, the one person said, how do you respond when people say, let's leave politics out of work?
You know, one thing I would say is I would hope as part of all of our efforts that we as organizations are encouraging our employees to vote. I mean, take an active role in that. And we don't want to get in necessarily to who those individuals are and who they should vote for. That's not our role, but just making sure that we're encouraging folks to support that political process.
Mm-hmm. Mm-hmm.
But Barbara and Michiko may have other thoughts, but
Because what we're, go ahead,
I
Barbara.
think that, you know, if we think, so you can say no politics at work, and if do you really think people are not having these conversations? They are, right? And so they may not be having them with you, but they're already having the conversation. So, you know, you really do have to pick and choose, right? You want to make sure that everyone feels welcome, that everyone can participate, right? So you want to make sure that you're not excluding people. And I think that's important, because sometimes we'll say, yeah, there's no politics at work, but then, you know, there's something around politics that happens, and then no one is standing up to say, oh, well, wait a minute, there's no politics at work. And some of this has been politicized, but there's also experience that people have. And so they're not talking necessarily about their political view, they're talking about their experience. And this is the reason why we talk about why saying Black Lives Matter, recognizing that not everybody believes that. There are individuals in our organization that believes all lives matter. We're educating on why we're saying Black Lives Matter. Because again, you know, we come to work and we may be very much connected and integrated, but when we go home, we're not. And so, you know, we don't have the same self-awareness, or, you know, we're not in the communities, and perhaps all we're hearing is from the news. So we just have a slant perspective, but it's important for us to say, hey, everyone is welcome here.
Yeah,
Can I also just add, I know that we are out of time, but, and David might think that now I'm brown nosing because I have a budget meeting with him, but I wanted everybody also on the call, or the attendees, to understand that David's here for a reason, right? He's not checking the box, he said it. He's very invested in this, and it starts at the top. It embodies all of us. But David, along with the dean, along with his colleague Paul King over the Children's Hospital, they are truly authentically vested in this. And part of David's being here today is also for all of you, if you need to go back to your leadership. I'm not going to say call David, he'll call your CEO, but
no, I will say though, I will offer that, because again, if you're needing somebody to ratify or talk about why this is important, please have them call me. Have your CEO call me and say, okay, is this true what I was told? And I would say yes. So happy to do that.
Yeah, it's important. We have the support, and so it permeates, and it's about all of us. But you know, and I thank you, David, again, not round nosing, but part of it is because it is really important. It has to be embedded into everything that we do.
Yeah, absolutely. Well, we've come to the end of the program, and we want to thank your time, David, Barbara, Michiko. That's it. This has been an incredible conversation, and clearly, with the interest and the various questions that we have, this was not enough time, but we need to continue on the conversation. I think we're all on the journey together. Please know, for those of you that are attending, if you've asked questions that we're unable to get to, we'll do our best to try to get a response to you. We want to keep this dialogue going. And we will also provide all attendees with a link to the audio today for the recording, the slides. So watch for that in the next few days. Thank you so much, all of you, for having this important dialogue, important conversation, and sharing your journey with us.
Thank you.
So with that,
Great.
we'll conclude today's program, and be sure to give us your feedback by completing the survey as you exit the webinar. Thank you, everyone, and I hope everyone has a great day.
Thanks, Chris.
Thank you, Chris.